Hi, I'm Kwek Chun Gyok, founder of Canaan Health Foods and the product Manna. Manna has been around since 1996 and it has helped many patients go through major surgeries, cancer treatments, many kind of health issues and even neurological disorders like Parkinson's, dementia, too much to name. Today I have Joan with me. Hi Joan.
Hello.
Would you like to share how you first hear about Manna?
I first heard about Manna from my pastor in church back in probably last year or early this year. Yeah.
Yeah. So, you would like to share about what happened to your brother recently that he started using Manna for his condition. Maybe you just what happened to him and then how Manna was introduced to him.
Okay. So last year December he experienced a stroke. So his blood vessels ruptured in his left brain. Yeah. So he was brought to the A&E and after induced coma for a month, he was brought home. Yeah, he woke up afterwards. So doctors were saying that he's gonna be like that forever at a vegetative state. So after, because I mentioned that Pastor Lilian was the one who shared Manna with me and my family, I personally tried it for myself and I thought this is nothing bad. Yeah, why not give it a try? Yeah, so in about April, I started giving him a bottle of Manna every single day. He is able to be more alert and in terms of his wakefulness, there's an improvement as well.
Why the delay from the stroke to April?
Correct.
4 months later.
So we've been pushing in the hospital because like I said, he was in ICU for a month from the starting of December to the end of December and then he was transferred to the normal ward and community hospital. So we've been pushing for Manna ever since he's in ICU. We received a lot of no's from the doctors and we also agreed as family members that we are going to take full responsibility for it if anything were to happen in the hospital. So after a lot of they will send the product to the lab to
But they did
check.
nothing about it, right?
Actually, we have no idea because it was just a conversation, right? They just say, oh, I'm going to bring it to the lab and check it out. But every single time when they come back to me, they will say that, oh, my pharmacies don't allow because this and that. They didn't give me like the actual reason why, but I couldn't push it further in the hospital, so that's why the delay.
So from the time your brother started Manna, that was 4 months. 4 months after the stroke, right?
Correct.
What kind of improvement other than just like, his cognitive function is better? Any other things that you can add on in terms of like energy, appetite? Does he need a lot of help? The stroke patients, sometimes they have problem with movements and all that.
Yeah. Actually, he is bed-bound, right? So, and cognitive wise, like I said, he is able to understand more instructions. So he is able to help us to help him. Yeah, we don't have to use so much energy and strength. His energy definitely improved. We can see that he can do a little bit of things by himself independently, although he's not able to speak because of the cognitive function. But other than that, his wound healing, because sometimes he might have pressure shock sores, we see the recovery in 1 to 2 days actually. Yeah, so that was pretty fast. And also other wounds that has been affected while lying down, friction with the material of the clothes.
Of course.
Yeah, so these wound healing took about 1 to 2 days. It was really fast.
So he doesn't really have any issue with bed sores and all that?
No, not at all.
So would you attribute that it because the family has given him mega dose, like 1 bottle a day during the time of recovery, that he has helped the wound healing so far?
Yeah, I would totally agree on that. Yeah.
So maybe you can share a little bit, how old is your brother?
Um, 35 years old when it happened to him. 35 years old. 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 35 years old.
35. So this year is 36.
Correct.
Okay. So does the doctor mention about his recovery? Like it was like quite so-called amazing because he was induced in coma for 1 month. For some people, they will remain in the vegetative state,
Right.
and for him to be able to recover, so-called, is in itself quite miraculous. First time I'm hearing it.
Oh,
Yeah,
okay.
yeah.
Oh, yes. Doctors were amazed that how is he able to sit upright.
Now he's able to sit up with any help or
Oh.
something to prop him up.
Yes, definitely.
Yeah.
We need equipment to prop him up to transfer to the wheelchair. Like what you said, doctors actually expected he's going to be vegetative state for the rest of his life. However, he is able to sit on the wheelchair. He's able to maintain head posture. They don't expect him to be able to maintain
Hold his head.
correct, and also his trunk movement.
Oh.
So in all of like having Manna, giving him the energy and also the strength, and also improving in cognitive function, it all helps to bring him to where he is right now. At the same time, yeah.
Okay. So, is there anything you would like to add about Manna, other than helping your brother? What about people on the average? You have tried Manna, and you
Yes.
said it helped you in what way?
Oh,
Are you always tired? Or?
no, because I had like my upper lips were peeling, so nothing helped. I couldn't eat well. I was in a lot of pain. So after trying Manna for 3 days, the wound healed and I could eat and brush my teeth. So I thought, yeah, it worked, and it definitely gave me energy. That I felt the change because of my brother's incident. We don't get a lot of sleep. We don't get a lot of rest. Thus, we are
Sure.
very tired. So I do feel the energy boosting in me after having the Manna.
Your condition was as a result of looking after your brother. Is it this lip problem, or
it was.
originally you already have this problem?
No, it was frequent visits to the hospital.
That means the stress have
Yeah,
also
the stress.
affected the caregivers. Is that right to
Yeah,
say?
correct.
Wow, I am so thrilled and so encouraged that Manna. I wanted your brother to take Manna for the longest time, but the doctor. I understand that no. So when you say finally you all agree, I was like, oh, 4 months is too late.
Yeah,
But thank God that it still worked for him. And we have quite a number of stroke patients at younger and younger age. So I hope by your sharing with us how it helped your brother, that people will be more willing to give it a try. Because Manna is natural, it's not a drug.
Correct.
It definitely will not harm the body. In fact, when our body is into all sorts of stress, nutrition is the most important thing to help the body recover. Honestly, not drugs.
Yeah. we
Although I'm
agree.
medically trained, but you know,
Yeah.
and thank you very much, Joan, for coming forward to share with us. And how much Manna is your brother taking now?
He's taking a bottle is about 60 ml.
Yeah, 60.
He's taking a bottle a day. Yeah.
He's happy to take it?
Yeah. No issues.
No issue,
No issue.
The taste is okay,
I personally like the taste. I
Thank
think
you
he
very
does
much.
too.
Thank you for giving that thumbs up. Thank you, Joan.
No problem. Thank
Yeah.
you.